Welcome everyone to the ASAP webinar series for PEPFAR USAID local partners. Today's series is on PEPFAR expenditure reporting, and we're additionally going to take some, have a mini presentation on COVID-19. We're going to hold for a couple minutes and let others join and then get started. Put ourselves on mute right now and then keep talking. I see we have a pretty good number already joined for the series, so I think it makes sense to get going. I'll give a brief background. I'm Debbie Khalil. I work in the USAID Office of HIV/AIDS in Washington, D.C. And I am also the contracting officer representative for the ASAP project. This is a webinar series that we've kicked off already over the last few months. This is number 5 of our series, and this is a companion session to the one we had yesterday on PEPFAR budgeting. Today we're talking about PEPFAR expenditure reporting. And as yesterday, it was great to have an exchange on COVID-19 at the beginning. We were lucky to have George Syberry, who is working in our office on a task force for COVID-19 and its impact on our HIV programs. We really appreciated the questions you all submitted ahead of time and the information and the questions during the session. We are compiling all of those questions and are sharing the responses back to you all in written form, so you'll have those as reference. We've gotten a few additional questions that have come in, and today at about an hour into this webinar series, we'll have our director of our Office of Assistance and Acquisitions and another colleague from the Office of Assistance and Acquisitions here in Washington at USAID join to also respond to some questions, share a little bit of information, more about the award side of the impact of COVID-19. But before we do that, we're going to turn it over to a colleague in our Office of USAID's Office of HIV/AIDS who works on expenditure reporting. She's going to walk us through PEPFAR expenditure reporting and share with you the latest and the greatest on that. If you have questions, please type them into the Q&A box. You'll see a tab at the bottom of your screen that says Q&A. So please add those in as we go. We'll try to pause if questions come up or take them at the end. And we really hope this is an interactive, dynamic conversation as much as possible via webinar. So please add in any questions as we go. Before I turn it over to Erin, I'll offer a chance for Catherine Brokenshire-Scott, our ASAP project director, to say a few words.
Hi, welcome everybody. We're really happy that you've joined again. We have 89 people on the line. This particular webinar is very important, as we all local partners will have to do PEPFAR expenditure reporting. It's so important that we're going to be repeating this in September or October when the task is actually has a deadline in that time period. So please ask your questions now. ASAP will be helping you to prepare the expenditure reporting as much as we can. Also, we're going to be sending out a survey after this webinar to get topics that you would like us to cover in the future. So please take a moment to fill that out. We'd really appreciate it. Thank you, and over to you, Erin.
Great. Thank you, everyone. Just give me 1 minute while I pull up the presentation. Great. Well, welcome everyone, and thank you for taking the time to learn a little bit more about PEPFAR expenditure reporting. As mentioned, please feel free to chat your questions at any time. We'll be taking some breaks throughout the presentation for us to pause and answer some of those questions, and we'll also have some time at the end to do so as well. What we'll talk about today is an introduction to the PEPFAR expenditure reporting process. We'll look at the ER classification. We'll talk a little bit about the submission process, although this is something that we will not be doing until the later part of the year, around October. So you don't have to worry about anything at the moment, but we'll talk about it. And then finally, we'll talk a little bit about how the US government uses the expenditure data that you submit to us. So Catherine mentioned this a little bit yesterday, and I think it's important for us to go back to these three guiding pillars within PEPFAR, and that sort of is setting the scene as to why we collect expenditure data. We've received these funds from our U.S. Congress and their U.S. taxpayer dollars, and so it's important that all of us understand that we need to be good stewards of the funds that we have been given, and so that really gets at PEPFAR's foundation at this time for accountability, transparency, and impact. So we want to ensure that we are demonstrating cost effectiveness, that we are actually working towards sustained epidemic control. And I think we have one person or two on mute. If you wouldn't mind just muting yourselves, thank you. And just ensuring that we're being transparent with the data that we collect and how we use it. So a little bit more background about PEPFAR data. Expenditure data is one of the four primary data streams within PEPFAR. And so this is our MER data, which is monitoring, evaluation, and reporting. That's our indicator data, so the number of people that we're testing or the number of people that we're putting on treatment. We have our SIMS data, which is looking at our quality data within all the facilities. Our expenditure data, so that's what we're going to be talking about today, and then something called the SID, which is what we're looking at for sustainability within our programming. And so I think this is what distinguishes, this hopefully will show you what distinguishes expenditure data, what we're talking about today, from what Catherine talked about in her presentation yesterday, which was certainly all of the PEPFAR financial requirements and the reports that you have to submit on your actual spending. But I want you, as we go through this presentation, to think about spend in this context more about data. This is how we are telling our story about the work that we're doing. And this is how we're different from, again, from the budget data or from the outlay data, where you don't really have that programmatic context and background. That is where ER is really distinguishable in that sense. So again, I think that within the PEPFAR space, a lot of us talk about spending. And even within the US government, there could sometimes be some confusion on what we are talking about or what the analytical question is that we're asking. And that is important to know and to keep in mind as we think about which piece of financial information is important to look at to answer that particular question. And so I've outlined here the difference between outlays, which is what Catherine talked about yesterday, and spend via expenditures, which is what we'll talk about today. And I've highlighted here a couple of the main differences. First, the main difference is when we're talking about spend via outlays, we're talking about the US government spend. So if you as a partner are submitting invoices to USAID, we are paying you back. And so that outlay represents when we are reimbursing the partner for the costs that were incurred, or we are issuing a partner a letter of credit for work that is yet to happen. It's not exactly tied to the timeliness of the activities. Expenditure data is a little bit closer to that timeliness because we're looking at the spend within a given period of time. You are telling us that we spent $1 million within a certain period of time, and that is what we look at for that fiscal year. It's from the perspective of when you spent the money, not when the US government reimbursed you for that spend. So that is one big difference between outlay and expenditure data. Another big difference, which is sort of the biggest difference from my point of view, is that the outlay data doesn't tell us anything programmatically about our spend. We know that we outlaid $1 million, we spent $1 million, but we don't know if that was for activities that were related to testing or to treatment. That is what expenditure data tells us. It's that programmatic story about what was actually accomplished in a given fiscal year. We can look at that through testing, through treatment, but we can also look at that through beneficiary groups. How much did we invest in men? How much did we invest in adolescent girls and young women? And we can also look at that through the lens of what we call cost category. So that is another difference when we're trying to answer a question of a programmatic related question. Outlay data will not give us that. And so that's somewhat related to what I have highlighted here at the bottom, is that the outlay data is not at all directly tied to results or targets. We just know that a lump sum was paid out of the US government account. Whereas with ER, if we're talking about testing results, we can bring in the testing expenditures and we can look at those side by side to try to understand the impact and what happened in that fiscal year. So it's important to understand that because of the timeliness of these two pieces of information, when the money leaves the US government bank account versus when the money leaves your bank account as the partner, outlays will not equal expenditures. And so this is something that is a little confusing to folks because, again, I think we use the term spend very generally, but that timeliness is actually very, very important when we want to understand the impact of the dollars invested. So kind of building off of this is an introduction to why we have expenditure reporting. And so we talked about the 3 pillars of transparency, accountability, and impact. But what expenditure aims to do is to help us have more reliable data, to be able to have more timely data, and to answer programmatic questions. You probably have heard us talk a lot about the COP or the ROP process. That's the country operational plan or the regional operational plan for those countries that are part of a regional program. And that is essentially just our strategic planning period where we are discussing with our interagency colleagues, with OGAC, the Office of the Global AIDS Coordinator, who ultimately approves these plans for what we intend to do for the next fiscal year. So expenditure data, in combination with the other data streams that I introduced a couple of slides ago, all of that is part of the COP and the ROP planning process. So it's important for us to look at all data sources available, as PEPFAR, as many of you probably know, is a very data-driven program and initiative. And so expenditure data is one piece of that puzzle that helps us with our decision-making and planning. PEPFAR has been collecting expenditures since about 2014. We had an initiative called Expenditure Analysis. And in order to sort of better align with how other donors, such as the Global Fund or the Ministry of Health, were also collecting and looking at their expenditures, we phased in something new called expenditure reporting. And there was just better alignment between all of the donors so that we were all looking at the same framework within the context of what are we spending our money on. So expenditure reporting was phased in about fiscal year 2018. And what this chart is essentially showing us is that we ultimately want to be able to tie our budgets with our expenditures and understand if that budget was executed in a way that was according to how, if the expenditures essentially are representative of how the budget was approved and if it was executed a certain way. And so our budgets were not set up according to this framework in fiscal year 18 or 19. But as I've highlighted here, we started to phase that in COP19 or fiscal year 20. And we are doing that right now as well for COP20 and COP21. And so what this essentially means is that we want to understand our investments through these 3 different lenses of program areas, beneficiaries, and cost categories. That is an important piece of information for us to understand what we are actually investing in. But another important piece to OGAC is ensuring that these budgets are being executed according to how they were approved. And so that means that the budgets that we are setting right now in the COP planning process, they are budgets by interventions. So we're looking at that combination of a program area and a beneficiary, and then a certain dollar allocation. And the expectation is that once we discuss the budget programmatically, that we communicate that with the implementing partner during the work planning process. And then with expenditure reporting, the partners are still reporting on their spend according to how the budgets were set. So we do that alignment and that exercise to see that if there were any challenges or any hurdles within implementation on the target achievement side, what also happened on the financial side? How did the partners spend their money? Perhaps they did not spend their full testing budget, and maybe that contributes to the reason why they didn't reach their testing targets. That's one question that we could ask. But that budget versus expenditure is a relatively new piece to PEPFAR programming, and we haven't quite gone through that exercise yet because, again, our budgets just weren't set up to this classification structure. But starting with this fiscal year reporting cycle, we will begin to see how budgets are actually executed. So let's talk a little bit about the methodology and the basics of ER. And so what this is, again, just keep in mind, this is a little bit different from how you are reporting your financial data for like your SF 425 and some of the reporting requirements that Catherine talked about yesterday. Expenditure data is reported on a cash basis of accounting, so not an accrual basis. You will report to us on what cash actually left your bank account by September 30 of this year. You will only report on USAID PEPFAR funding. So if you receive other funds from other donors like the Gates Foundation, or if you also receive USAID money in maternal and child health or nutrition, etc., you will not report those dollars to expenditure reporting. Expenditure reporting is explicitly for your USAID award that received PEPFAR HIV funds. You will report expenditures on an annual basis to USAID according to your implementing mechanism. We call it an IM, and that's essentially just the project that you're implementing right now. But each mechanism will submit a template so that we can see individually how each mechanism is spending and investing its dollars. You will report in US dollars. We know that most of the implementation happens in local currency, but that will need to be converted to US dollars. And you will report to us with any given fiscal year, and that is the US government's fiscal year of October 1st to September 30th. So you can see that period there. We're in the middle of the fiscal year right now, but this will be the period of time that you will report on your spending to us when you report later in the year. Expenditure data is reported at what we call an operating unit level, and that basically just means a country. We call it an operating unit for a couple of different reasons, but for those of you who have targets, you report your targets at a district or a site level. For expenditure reporting, you are not required to do that. We just want to know how much did you spend at a national level. So that makes your reporting a little bit easier on the expenditure side. The prime partner is responsible for submitting the expenditure template. And if you are a prime that also manages subrecipients, you are responsible for collecting that subrecipient information and putting it into the expenditure template. That is your responsibility as the prime. There is one thing I should note is that because we are just wrapping up the COP planning process season, and we haven't quite transitioned over into planning for the next expenditure reporting cycle, we are not, and this is something that is managed by OGAC, so we implement this process as set and directed by OGAC. We have been told that it's possible that subrecipients will actually complete their own template. So rather than the prime partner collecting data on behalf of the subrecipient and then including that in the prime's template, it's possible that each individual subrecipient will also complete their unique template. We don't know if that is going to happen or not. I think that's the direction that OGAC wants to go. Whether or not we are ready for that this year is unknown at this time. But the takeaway message here is just ensuring that all of the dollars that were spent in that given fiscal year, whether it's the prime or the subrecipient, are included in the expenditure reporting template. And then finally, the expenditures that are reported, the process is mutually exclusive and comprehensive. And that essentially just means that every dollar in the template has its place. There is no double counting. There might be a little bit of cross-cutting activities, but eventually you will put your dollars in just one place. So we're going to talk a little bit about this financial classification system that we have for expenditure reporting, and that is basically looking at our spend or doing our budgets by what we call an intervention. And an intervention is the combination of a program area plus a beneficiary, and that combination is one intervention. So the intervention is made up of the program area. So that is answering the question is, what is the purpose of this mechanism? What is it doing? The beneficiary group. So who is benefiting from the work that is being done? And then the third lens in which we look at our expenditure data is what was purchased. What did you as the partner buy? So we'll break down the intervention, these two categories of program area and beneficiary, and that's the intervention. The third part of this is the cost category, the what did you buy, but we'll talk about that in a minute. Let's just talk about the intervention. So a program area is essentially 4 different site level program areas. We have one above site level program area, and then we have one program area called program management. Those 4 site level programs are prevention, testing, care and treatment, and something called socioeconomic. And socioeconomic is just our Orphans and Vulnerable Children program, or what we call OVC. So when I'm talking about site level and above site level, some of you may be a little unfamiliar with that terminology within PEPFAR. And so site level activities are essentially those activities that occur at the point of service delivery or at a facility level. So when you're talking about activities that happen within a government facility or a private lab or a private clinic, those are point of service. You can say that those activities or that personnel is directly tied to one facility in the community. It's very, very specific. That's site level. Above site level is going to be those activities that are essentially supporting either the broader population or the broader health system. So that's more activities like policies or health system strengthening, some coordination, research, surveillance, and surveys, et cetera. We can't necessarily tie the results of those activities to one particular facility or site, right? Those are cutting across the whole system. So that's the difference between site and above site. And then sort of the last piece of jargon here and way that we distinguish our investments is something that's really important to PEPFAR, and that is looking at our investments in service delivery versus non-service delivery. So service delivery activities are those activities that have direct interaction with beneficiaries. And so some examples of that are partners who are just strictly implementing differentiated service delivery models. You're fully doing direct service delivery. Linking and referral activities that are related to treatment services in the community, right? These are examples of service delivery. You're directly interacting with the clients. Non-service delivery activities are those that don't directly have an interaction with the clients, although money is still spent at the site level. We're still tying these dollars to what is happening within a facility or a laboratory or something like that. And typically what we see for an example of non-service delivery are those activities related to technical assistance or training. So when you think about service delivery, like those who are essentially carrying out the service delivery models, the non-service delivery component would be technical assistance or training to strengthen those who are carrying out that direct service delivery. Monitoring and supervision of the data clerks, things like that. Those are all examples of activities and dollars invested at the non-service delivery level. It still helps us to achieve results, but it's not related to the direct provision of services. I'm just going to highlight the program areas. And again, these are site level. And so what we have are the program areas. The first one that we have is care and treatment that I will go through. And that is that broad program area. But you can see we also have sub-program areas. And so that first sub-program area is HIV clinical services. And you can see that differentiation between service delivery and non-service delivery. And so as we go down the line in the sub-program areas for care and treatment, you can see that we have the sub-program areas of clinical services, care and treatment for laboratory services, care and treatment for our HIV drugs, and then we have something called care and treatment non-disaggregated. And essentially that just means it doesn't really fall specifically into one of the 3 other sub-program areas of clinical services, lab services, or drugs. So there's just this sort of other bucket. And so you can see that there's a number of different ways in which you could actually categorize your expenditures just within all of these given sub-program areas, and then the additional differentiation between service delivery and non-service delivery. So that's the care and treatment program area. We also have the program area of testing, and we have our facility-based testing, our community-based testing, and then we have prevention activities. So this is community mobilization, our VMMC activities, PrEP, condom and lubricant programming, opioid substitution, and then again, that other category. And then our final 4th site level program area is socioeconomics. And these are all the sub-program areas related to our OBC programming. We talked a little bit about above site and how that's really supporting the health system in general and the population. So you can see the examples of the sub-program area are very distinct and different from what we were just looking at in the sub-program areas for the site level, right? We're talking about HMIS, surveillance and research, lab strengthening, public financial management strengthening, policies, et cetera. So you can, I think, this is a lot to digest at the moment if this is new to you, if you're seeing this for the first time. I also want to point out that there is a guidance document that is available. I have the link at the end of the presentation where you can actually see the definition and the inclusion and the exclusion criteria for all of these different program areas and sub-program areas. It's not light reading, but at the time of reporting, and if you want to get ahead of it, you can kind of skim through this document now, but it will in much more detail explain to you, it will be more obvious when you're looking at how to categorize your expenditures and your activities, which category it should go under. There is a guidance document to help you do that. The last program area that we have is called program management. And this is where we are looking at essentially what your organization is spending for your indirect cost or for your overhead. So that's an important piece of information for us to know. For those of you that have NICRAs, you would include this as well. Not all of you have NICRAs, but for those that do, you would still include your overhead and your indirect costs. And we just want to separate that out from your direct costs. So that is the first lens of how we look at our expenditures within PEPFAR. When you think about how much money the program and the initiative has, it's important for us to understand globally or at a country level or even at a partner level, how much are we investing in treatment? How much are we investing in testing? How does that change from year to year? And so program areas is one way for us to look at that information. And that's the first part of our PEPFAR intervention. The second part are our beneficiary groups. And so a beneficiary is just essentially the intended recipient of a PEPFAR program. There are some beneficiaries, and I'll introduce those in just a minute, but there are some beneficiaries that may fit into more than one group. You may be a male who is also a key population. You may also be a female who is also within a key population or a priority population. But essentially, you would pick the beneficiary group that is the most dominant of the work that you are doing. And sometimes there's not one dominant beneficiary group, right? And so we do allow for that flexibility. Again, we have that kind of that non-targeted, non-disaggregated, where it's a little bit more of general population, or it's a combination of more than one population. And there's a lot of different options. And so these are the 7 different beneficiary groups. They're broken down into the demographic of females and males. And then we also have these targeted beneficiary groups. So the key pops, the pregnant and breastfeeding women, priority pops, and then our OBCs. And I already talked about and mentioned that non-targeted population. Because a lot of these beneficiary groups can be in more than one, oftentimes we see that the expenditures are just put in that non-targeted, unless we're really trying to call out the work that we're doing for an important population for that mechanism or for that particular country, then we would really call out the beneficiary group. I'm not going to go through all of these. Again, there's a very riveting guidance document that you can read that describes all of this. But this gives you an idea of, we looked at the sub-program areas, we also have sub-beneficiaries. So we don't just look at females, but we disaggregate that beneficiary group as well. And so again, as you receive these slides, go ahead and take a look at them. And you can see how the different, all the different sub-beneficiaries that we have. So we talked about program area and we talked about beneficiary, and that combination of those two is what makes up a PEPFAR intervention. And so this is an example here. I've called out intervention number 1. You can see that we're looking at a testing intervention, more specifically, a community-based, service delivery community-based testing intervention, and that's aimed at KPOP sex workers. So there is that first column where we would see, we want to understand what that partner invested or how that partner spent their money on community-based testing for sex workers. And then you can see in the second category the same thing. You have a socioeconomic, which is your OVC category for education assistance. The beneficiary group are going to be the OVCs themselves, and so on. And so this is the main framework and categorization for us as we're looking at our investments in PEPFAR, is within this framework of a PEPFAR intervention. Now, a lot of you partners might be thinking, wow, we could have 100 or 200 different interventions if I think about all of the activities, all of the different program areas in which you work, and all of the beneficiary groups. You could have care and treatment clinical services for men, care and treatment clinical services for women, care and treatment clinical services for adolescent girls and young women. And then you have your service delivery for all of those beneficiary groups, and then the non-service delivery. So it can get quite large. And I think that when OGAC structured this framework, it was not with the intention of knowing this granular detail, because that would be quite impossible and very difficult for you as implementing partners, because your accounting systems are not set up this way, right? This is the challenge with expenditure reporting, is that your accounting systems will more or less be set up according to the cost categories of personnel and travel and ODCs and things like that. But you don't have that background on how the money was actually spent by a program area and a beneficiary group. That is why it's important when doing expenditure reporting that I'm guessing most of you are probably more on the financial side, but it's also important to bring in folks on the programmatic side as well. There's no way when you're looking at your accounting records for the last year that you can allocate your expenditures according to these different PEPFAR interventions. But there's also no way that a program person, like an M&E advisor, can also do expenditure reporting, because they may not be as familiar on the money side. This is a process that is really something that you need to have both the program and the finance folks come together in order to do this. And so in order to make this a reasonable process, OGAC has limited the reporting to 20 interventions. And so what that means is that you're not going to have to break out all of your spending 100 different ways. You only need to break out up to 20 ways. And in most cases, I don't even think that the budget is broken out by 20 interventions. And that's because a lot of activities are combined. And so it's understood that while you may have an intervention that is clinical services for service delivery, there might be some non-service delivery budget or non-service delivery expenditure included in that. So there's a little bit of a flexibility with that. Expenditure reporting is an estimate. This is not an audit. This is not the financial report that you send to USAID, which is your SF-425, and that is your legal document that you are giving to USAID that's signing off on what actually what you need to be reimbursed. Expenditure reporting is an estimate, and we do expect that it is a very best estimate on your part, but we understand that there is flexibility with the reporting. So we talked about the intervention, the top two parts of the expenditure template that we are looking at here. And then the last piece, and then if you have questions, go ahead and add them into the chat, and I'll take a break after we go through the classification structures here. But the last piece, or the last lens that we look at our expenditures, is through the object class or the cost category. What did you buy with your money? And so we have 11 different cost categories that you can see here, from personnel, travel, supplies, training, subrecipient, et cetera. And these align, with the exception, I think, of training, but these essentially align with the categories that you are reporting to USAID in your quarterly pipeline reports or in your annual reports. And this is very likely how your accounting system's set up. So this is one benefit, is that you don't have to take your expenditures and report them in different cost categories. This is aligned with how you're already reporting your cost to USAID. Again, I'm not going to go into the details of this because there is a guidance document, but you can see the details here. Again, we have that cost category, and we have a sub-cost category. So it's not just personnel, but we look at personnel for salaries, wages, and healthcare workers, and then salaries and wages for other staff. Same thing with travel. We want to look at international travel and then domestic travel. So I'm not going to go through all of these slides, but you can see that there is that differentiation. I'll stop here and see if there are any questions that I can answer before we move on to completing the template and talking about use of data.
Thanks, Erin. This is Debbie Khalil again. We have a lot of questions that have come in, and that's been great. Thank you so much for the presentation thus far. I'll jump to a few questions, and Catherine, add in if I miss any. First question is, how much detail is in a work plan budget? Would it be helpful? It would be helpful if you could share an example.
Essentially, what we're looking at with so there are a couple of different ways that you can do a work plan budget, and ultimately the AOR or the COR for that mechanism is going to take the lead on what they require of you for the budget. This year should be the first year that you will also be given your budget by intervention. So that is something that USAID will give to you. This will be a discussion that you have with your A and COR. And so when you look at the USAID will essentially set the budget by intervention for you. So if I can go back a couple of slides and we look at a template, the top part of the template, the program area and the beneficiary, when you go across all of the columns, and then you look at the very bottom where it says total, it says facility-based testing for adult males at $775,000. That is something that the US government is doing. So you will not have this detail of cost category, but USAID is right now working on each of the mechanisms budget by cost category with the overall total. So when you have that discussion about work plans with your A and COR, you will be given your budget by intervention with that high level information, that top line amount, and then it will be your responsibility then to complete the cost category portion. And that is what will make up your work plan budget. But more information will be coming on that soon. We're just ending the COP process and quickly pivoting to work plan, so that is coming.
Thanks. So in the expenditure report, how much detail is required per activity or program area? For instance, prevention, care, treatment.
Great question. And so again, because USAID is determining the intervention, this is why it is important that the USAID AORs and CORs and activity managers have a conversation with all of their implementing partners about the budget, because and some of you may have been involved. It sort of depends on the country, and it depends on the team, and it depends on the partner. Sometimes there are budget proposals that are discussed with the partner, and sometimes they're not. But we're really encouraging that communication really needs to happen. If your AOR doesn't reach out to you soon about this, then we certainly encourage you to proactively reach out to them, because they're the ones that made the decision on what activities are included. So in the past, some of you may have done, I don't know if anyone on this webinar has done ER before, it's possible. And you might remember that partners actually completed the ER template according to what they thought that their expenditures were. But because ER was phased in, USAID is now setting the interventions. And so USAID in their budgeting process knows exactly what activities are included. So you should have that discussion with them once you get your budget by intervention to ensure that you are clear on what activities are included in each of those interventions and what needs to go where. Great question.
Thanks. Are local partners under a fixed amount award, FAA, expected to submit expenditure reports?
More broadly, it doesn't matter what the award type is. If you spent $1 of PEPFAR money, you are required to submit an expenditure report. What basically is what the qualifying factor is that you received and you expended PEPFAR money, regardless of the mechanism, regardless of the partner type. It is about we want to understand how we are investing our money. And so anyone that spends that money, we want to know how it was spent.
Thanks. Here's a pretty detailed question. So since it's only cash spent through September 30th, what happens if you do an activity on September 20th, but the invoice doesn't process and leave your account until after October 1st? Does that then count against the next year funding, even though the activity happened in the previous fiscal year?
That is correct.
You report this money if you can't report accrual.
That is correct. So this is where this is one of the limitations of expenditure reporting data. When OGAC set up the structure of this, they wanted to ensure that they only counted that we're working on the cash basis of accounting. So even though you may do an activity on September 20th, but it doesn't pay out until October or November or something like that, it will not be in your expenditure report for that fiscal year in September. It is one of the limitations, but when you think about from year to year to year, you're probably going to see that same phenomenon happen every single year, right? Where you're going to be paying out some activities from the previous year. It's part of the context and understanding when we're interpreting the data, but that's the methodology that OGAC wants to use for expenditure reporting. But I assure you, it's understood in the interpretation.
Thanks. Can you explain the difference between EA and ER?
Sure. So expenditure analysis was the first iteration and the first framework that was how we were looking at our investments. It was a brand new thing in 2014 where we collected data programmatically. We looked at it still by program area, still by cost category. We looked at it geographically. We also looked at the data by point of service. It was a very clunky and well, it wasn't clunky, I guess I should say. It was very granular, and that was the great part of EA from my perspective, is that we knew exactly what we were spending at points of service and in each district, in each site. And that is how we talk about PEPFAR data, particularly our indicator data. So the problem is that it was a very difficult process for implementing partners, but I think more importantly, it wasn't aligned with how other donors were also reporting on funds. The ministries of health are spending money on HIV, and they were using their own categorization system. Global Fund, they spend a lot of money on HIV, and they had their own categorization. So we weren't all fully aligned to understand within the country of Tanzania, how much are we investing in HIV for care and treatment for a certain beneficiary group, and what are we buying? We just weren't all quite aligned. And so there were a number of different ways why it made sense after we had done, I guess, 4 years of EA to do a refresh and a 2.0 and to improve the process, improve the reporting, improve the data use. And that is the difference between EA and ER, is it's just the methodology is different.
Great. Can you, wait, sorry, I want to make sure I'm on the right question. Can you give an example of typical quote unquote not disaggregated expenditure?
Sure. So if you're talking about, again, if you're thinking about all of the activities that, if there is a clinical partner that is doing a lot of clinical work, you may have a lot of different interventions to really describe that clinical work that you're doing, or some of it might be cross-cutting. And so you don't want to necessarily have an intervention that is for clinical services, for lab services, for ARV drugs, and for all of the different beneficiary groups. You're just generalizing that this is clinical services that we are doing, or this is care and treatment services that we are doing. It is not for a targeted beneficiary group. It is not for a targeted sub-program area. It is just sort of just the bread and butter of differentiated service delivery or something like that. Same thing with the beneficiary groups that are non-targeted. You'll see that actually when you get your budget by intervention, you will probably see most of the beneficiary groups are non-targeted. And again, that is because it's a lot of the work that we are doing is for a general population, or it is for more than one population. it's kind of the non-targeted, non-disaggregated allows for that flexibility of where there are cross-cutting activities within a program area or within a beneficiary group. And so I think the kind of drawback of that is that it doesn't really tell us much. So when we are doing the data interpretation and analysis side, a non-targeted beneficiary group or a non-targeted program area, we don't really know what activities are included in that. But if there is a country team, a USAID mission team that has been told, I want to see all of your investments in men, or I want to see all of your specific investments in testing, you may want to call out those specifically and say, we are testing adolescent girls and young women, or we are testing men, and we are doing you're going to have more interventions within the area that is of the focus of the work that you are doing. And then some of the other activities that you're doing that are of less focus, you will have in that non-targeted. But again, this is what will be given to you. So, I don't think there's any flexibility at this point moving forward for partners to change the budgets by interventions that were set during the COP process. But that's a great question.
Great. Can you hear me?
Yes.
Okay. Can please clarify the classification of capacity building under service delivery and non-service delivery activities?
So capacity building will most likely fall under the non-service delivery category. The service delivery, again, is where we're talking about that direct service to clients, that direct service delivery. And so the capacity building is going to be the reinforcement of that. And so that is where you have clinicians that are a particular site. The capacity building is going to be the non-service delivery component to train those staff where there may be gaps or something like that. So capacity building will always fall under the non-service delivery. But again, if you look at the guidance document from the link that I'll have at the end of my presentation, you can see more detailed descriptions of that. And Debbie, I might actually put a pause on the questions, as I think we're going to try to aim to stop at 9:30. And so let me just go through the rest of my presentation, and I'm happy to take more questions at the end. That sounds fine.
Yeah, so I think in about 10 minutes, we have our Office of Assistance and Acquisition colleagues joining. So if you can get through the rest, and then we'll start back up after that presentation from Office of Assistance and Acquisition. We'll start back up with the questions where we left off. And one suggestion, Erin, too, as you go through, to just remind people of the timeline for when this all happens, and sort of keeping track throughout the year to prepare for that time that's coming in November.
Great, thank you.
And keep entering questions in the Q&A, and we will get to them all at the end.
Okay, so I'll talk quickly about the timeline. Again, there's no reporting that needs to happen right now. This is sort of an end of fiscal year reporting requirement. And so I hear from a lot of partners that say, gosh, why do you have expenditure reporting at this really busy time of year? We have all these other reports to complete. Why is there such a short turnaround time with it? And that is essentially because we need to wait for the fiscal year to close before we can even begin to open the expenditure reporting process. You're implementing right now, so it doesn't make sense for us to request any information while you're still implementing. But the COP planning process, the strategic planning process for USAID, really begins in January. And so that is not a lot of time for us to collect data, clean data, analyze it and visualize it in time for our COP discussions. And so, we hear you. I understand that this is a lot to do in a short amount of time, but there's really no other timeline that we can work off of. So again, this is a process that is directed from OGAC, and so they will typically put out guidance around mid-September. October 1st is when data entry opens, and so anywhere from October 1st until November 6th, that is your time to complete the expenditure template. We've been looking at that Excel sheet, and that is what you will be required to complete. November 6th, these are the actual dates for this year. Again, in the interest of time, I'm not really going to go too much into it, other than you have about 6 weeks to report The U.S. government USAID will review your template. They'll make some comments if something doesn't look right, or if they think that the reporting might be an error, you're missing dollars or something. That will be a kind of a discussion that you have with USAID on your template. We also allow for a cleaning window. So for those of you who may be familiar with the data entry period that happens on your targets and your results, it's the same calendar. Expenditure reporting is the same time that MER reporting is. And so you will go in and have your data collection, data will close, and then we'll have a data cleaning window where you can make your final changes. And then basically by December 18th, the reporting is locked. And this December 18th is a hard deadline. It's important that all dollars are collected and that everything has been caught, and that you are ensuring that you are telling USAID in the most accurate way possible how you spent your money, because after December 18th, we are unable to make any edits. That data is locked for that year, and then we start to begin using that data in January. So this is looking at the expenditure template. Again, this will be blank, but I do want to point out to you what your expectations should be about reporting. As I had mentioned, the USAID AORs and activity managers right now during the COP process are setting budgets by intervention. So they're going and through all of these columns, they're saying that you're going to have for column E that above site intervention of policy planning for a non-targeted group at $387,000. And they're saying that this partner will also have a prevention intervention for community-based mobilization behavior change for for young women and adolescent females at a cost of $173,000. This is one template for one partner for one implementing mechanism. You will be given that information by USAID. It may not be in this template, but I mean, you will be given the intervention and the intervention budget. You will be required then to complete the cost category information, and that's the personnel, the travel, the supplies, the training, all of that. So once USAID tells you what your budget by intervention is, we would like to know then what your proposal is for the cost categories. I talked a little bit about subrecipients. Again, in the interest of time, I'm not going to talk too much about it right now because there's still a lot that we don't know about how subs are going to be reporting. But there is a section on the expenditure template where you will say how many subs you manage, and then each sub will need to say what their total spend is by intervention. The subrecipients, we do not need at this time, according to the structure, the detail of the by cost category. We just need to know for that intervention of prevention, community mobilization for young women and adolescents, that sub-partner number one spent $6,500. Basically how the template is submitted is through an online system called Datum. You will have a lot more information and guidance on this as it gets closer to reporting on how to create an account. But essentially you will upload and submit your template. Your USAID AOR will review, and if they approve it, it will get sent up to an agency HQ level. Someone at USAID HQ will review, and then we eventually push it all up to SGAC. So for those of you who may feel like this seems a little bit overwhelming, I just want to assure you that there is technical assistance available for this process. So there are your USAID AORs, CORs, and activity managers in the field are your best sources of information. If you have questions on your work plan budgets or on your expenditure reports on how you do this, they will answer a lot of these technical questions for you if you have questions or concerns. You will also have your USAID HQ costing advisors, such as myself. We have a team of 4 or 5 other people. We each cover a portfolio of countries, and we are also able to answer questions for you. And then finally, we have these field-based technical assistance consultants who are not affiliated with USAID. They are not implementing partners. They're just consultants that we have who are sort of a help desk that can triage questions that you can email someone and say, I don't quite understand this intervention, or I don't understand the definition of this cost category, and those consultants will help you. So please understand that there are a number of different resources available. And I typically find that around the end of the fiscal year is a busy time, And so the mission teams are usually pretty great at having all partner meetings. And so around September or so, they gather sometimes all of the partners. It might be an individual meeting. It sort of depends on the country. But they'll just sort of have a kind of a longer meeting with you to explain all of the different reporting requirements. And so that is another thing to look out for. And then I'm just going to really quickly talk with just a couple of minutes that we have left about how we look at our data. I want you to understand that this template and this report that you submit to us, we actually analyze the data, we visualize it, we interpret it, and we use it for the purposes of program planning. So this is just an example of looking at expenditures by program area and by service delivery and non-service delivery. So we can see that top chart that this partner is spending the majority on care and treatment, and the blue bars indicate they are mainly a non-service delivery mechanism, or this is a non-service delivery country. And you can see at the bottom that's a very different makeup. They still have a lot of care and treatment, but they're doing a lot more service delivery. We're also able to look at our expenditures by beneficiary groups, because that's, again, the second part of the intervention. So if it's really important that in a particular country the epidemic is driven by men, that we see our investments by men, and hopefully that's a sustained investment or it's an increasing investment. And you can see some of the questions on the right here, the analytical questions that we ask. And then that third way that we look at our data once it's been analyzed and visualized is, what are the cost drivers? The cost drivers for that partner, the cost drivers in that country. We want to get an idea of what we're actually buying with our dollars. We had talked about budget execution, or the budget versus expenditure, and that again is just ensuring that if OGAC is saying we're spending all of this time to talk about our budgets, and we're going to approve a certain budget, we want to ensure that that budget is being executed as it was approved. So if you're given $2 million, did you spend 2.5 million, or did you spend 1.5 million? And how does that relate to your target achievement? And then again, how does that relate to more programmatically? Did you spend your testing budget? Did you exceed your testing budget? These are some of the questions that we ask. And then the last thing here is just talking about what I've talked about, is that this is a part of our budgeting process. You can see at the bottom those PEPFAR interventions. We can look at past budgets. We can look at past expenditure data. This is one partner that we're looking at here in the gray rows at the bottom. But basically, this is the story. This is a partner that does a little bit of care and treatment, a little bit of testing, and a little bit of prevention. This is telling a story about what the partner does, and we want to see those incremental changes from time to time. So these are the links where you can go to find more information. This deck will be sent out to you so that you can have reference for this website where all of the guidance document is. But I will stop there. Please continue to put your questions into the chat box, and then I will hand the presentation over. Thank you.
Thank you so much, Erin. This is Debbie Khalil again. We're going to jump back to some of the questions. We still have a lot of questions to answer while we're waiting on Mark Walther from our Office of Assistance and Acquisitions to join. And then we'll stop the questions when he joins, get his presentation, then come back to the questions. But Erin, that's been a fabulous presentation and a lot of great information. I think people are really interested and have many questions. So I'll come back to where we left off. The question is, rather than wait for annual reporting, wouldn't you recommend that OUs do ER reporting quarterly or cumulatively?
Right, so this is a great question. And so some of the things that you can do now, particularly as you're getting prepared for your reporting for ER at the end of the year, the first thing that you should do is reach out to your USAID AOR/COR activity manager and ensure that you have your COP19 budget by intervention. That will help you. You probably already have your budget. It may not be a budget by intervention, but since this is how you will be reporting your expenditures, go ahead and proactively ask that of your AOR/COR now, so that you can have an idea of what the expectations are. But then also you can start to look internally to see how you're tracking and how your spending compares. And then exactly. So think about what your organization can do right now. So every partner is different, and that's why USAID does not have prescriptive guidance on how we think that you should be tracking internally as an organization, how you should be tracking your expenditures. I think the feedback that I've heard from partners is that if you sit down and do this once a year, it's going to be a little difficult because you may not remember programmatically how a lot of those expenditures were executed, right? And so again, this is that discussion with the finance folks as well as with the programmatic folks. And so there are some organizations that really do just prefer to, look at 12 months of accounting records and then do the reconciliation there and to try to fit those expenditures into the programmatic interventions. But there are other partners that are basically monitoring, they're doing those reconciliations on a quarterly basis, or they're doing it on a monthly basis where they say, let's look at 1 month of our spend, or let's look at a quarter of our spend, and let's try to take those expenditures and put it into the interventions now. And we'll just update this on a regular basis. We're not prescriptive on how organizations prefer to do this because every organization is structured differently, but my recommendation is certainly to try to look at ways to adjust, how you're doing your timekeeping or how you're doing your record keeping in order to ensure that you understand expenditures by the program areas and again, the beneficiary groups, which are quite complicated. But yeah, that's it. My recommendation is to start earlier. And if you have questions, you can certainly reach out, on ideas that could help you, but definitely would say the sooner the better.
Great. I think Mark Walther has joined, but we may have to figure out how to get his phone line open. So we'll take one more question as we work that out. From another question on the ER, typically how much is allocated in terms of budget for admin and core costs?
For admin and what?
Core costs.
Oh, so that is it depends on the partner because every partner's indirect cost structure or every partner's NICRA is different. And so that is going to be something that is not structured the same for everyone within a given country or even within the partners that are managed by USAID and managed by other US government agencies. And so the way that partners are reporting to us what their program management expenditures are, those indirect costs and the overhead, things like that, we rely on how partners report those expenditures so that we can ensure that that is accounted for in the budget because we do budgeting on a mechanism by mechanism basis. One country may have 30 different USAID mechanisms, and so we do need to look at those individually. But we rely on how partners are reporting the expenditures to apply a percentage to know how to budget for the future.
Great. So Erin, thank you. And sorry for the interruption. We still have a good number of questions to address, but we're going to pause for a minute and turn it over to Mark Walther, who is the head of our USAID Office of Assistance and Acquisitions at USAID Washington. He has called in via phone. So Mark, I think to unmute yourself, you push *6. Hopefully that will work. He has a presentation he'll walk through, and if we have questions, please chat them into the Q&A. And if we cannot answer them at this point, there may be some questions we can't answer. We will also try our best to find answers and follow up in written responses. And keep in mind, as yesterday was a more focused conversation on the HIV technical side, today is a more focused conversation on the award management side related to COVID-19. So Mark, can you say hello and hopefully we can hear you?
Hi, Callie. I just want to make sure you can hear me.
Yes, great. This is Debbie, but yes, we can hear you.
Debbie.
So I will turn it over to you. We have your slides up on the screen, so please just let us know when you're ready to advance the slides.
Thanks, Debbie. And thanks, everyone, for being on the call today and for my GH Global Health colleagues for having us join this critical call. I think as some of you know, we do have a public-facing website for all implementing partner information that our office has shared out, and we will continue to update that site. I'm sure the link will be shared with you. In addition, we will provide updates to the implementing partners on any acquisition and assistance matters And there's an email list as well that we can share out to make sure you can sign up to that list. As all of you might imagine, there are a large number of questions that have been arising given the unique challenges being presented by COVID-19, the coronavirus. Our approach as we work through these questions on a daily basis is to post updates each week, which we will try to undertake by the close of business on Fridays. In addition to the questions we've been receiving from individual implementing partners and our contracting and agreement officers, we have been working through major implementing partner associations here in the U.S. These associations include the Professional Services Council, Interaction, Umentum, the Society for International Development, and the Small Business Association of International Companies. They have been especially helpful in expanding our partner outreach, prioritizing questions, and maintaining close connectivity on the issues that continue to arise in this very fluid environment. Please be assured that our global health colleagues have shared with us a number of the questions from local implementing partners that are under further review at this time. We want to make sure, to the best of our abilities, that we coordinate responses among us to ensure consistent understanding and messaging on the matters that you have shared with us. I'd like to take a minute just to highlight the items that we've shared out to date. On March 12th, we shared out some brief implementing partner guidance. On March, that was further then supplemented by a partner call outreach on March 18th. There's a script of that call highlighting a variety of issues. Then on March 20th, we implemented a variety of frequently asked questions. This is the first round of frequently asked questions that, again, we'll be trying to update on a regular basis. And then in this link, the public link to implementing partners, there's a variety of what you'll see memorandums. They're issued here in the U.S. by the Office of Management and Budget to give all federal agencies additional flexibilities in responding to COVID-19, both under grants and cooperative agreements, as well as contracts. So there's been about 6 of those issued to date. And as they get issued, we also update our website with that information, in addition to the frequently asked questions. I'd also like to point out executive expedited procurement procedures for infectious diseases. This was an item that was approved by the administrator on March 24th. The expedited procurement procedures, also sometimes referred to as EPP, enhances our agency's ability to address the rapidly changing circumstances of the current outbreak of COVID-19, but it also has abilities to be utilized for other infectious diseases as further detailed in the guidance and is valid for a 5-year period. The guidance provides some key critical abilities to all of our missions and operating units, similar in part to those available to missions familiar with PEPFAR, which were on the call today. More specifically, the memo approves the ability to undertake sole source or limited competition actions for new awards, and also to modify existing contracts, grants, or cooperative agreements in order to pivot existing awards to respond quickly to COVID-19 interventions. It also waives source and origin and nationality on the procurement of goods and services under your awards. We shared it out on the 24th with our contracting and agreement officers around the world. Please note there's no specific action any implementing partner has to take at this time. USAID representatives, our contracting and agreement officers, and our technical colleagues, the contracting officer representatives and agreement officer representatives, will reach out to you if they have situations where adjustment to your programs are desired by the agency to adapt specifically to COVID-19 priorities. Those are my initial thoughts that I wanted to share with you, and I know Christopher Nicola is also on the line, our contracting and agreement officer here in Washington, who leads PEPFAR operations on the procurement side, and I believe he also has areas that he would like to highlight in regard to further areas that we're working on to share out under existing PEPFAR programs. Thank you.
Thank you so much, Mark. Chris, is there any additional points you'd like to share? We'll turn it over to you.
Sure. Thank you, Mark. Thank you, Debbie. Yeah, so the last point that you all see on the slide is this global IP letter and process to PEPFAR implementing partners. Obviously, there's going to be lots and lots of guidance and communication to you all, whether it's from SGAC, Office of HIV/AIDS, or elsewhere. We just want to make sure that, we understand that there's going to be concerns that you may be tasked with responding to COVID-19, and obviously that would be communicated to you through your AORs and AOs, or CORs and COs, via the use of the EPP. But for the most part, as of right now, all the partners
Hi, Chris. Unfortunately, Krista Nicola has dropped off the Zoom line, and so we could wait a couple of minutes for him to come back.
And please, while we're waiting, we can also continue to input questions, and we can take those in a few minutes as well. So please, in the Q&A box, please insert some more questions. Hopefully Chris can join in a second. And Mark, is there anything to add while we're trying to get Chris back on? If you're still on, hopefully, anything else you wanted to add before we look at a couple inputs or questions from local partners?
Just in general, obviously we value and encourage these continued communication efforts, and also the on-the-ground efforts that you're working with your point people on the ground on situations you're facing, any interruptions or concerns or constraints that are occurring under your PEPFAR related programs, to make sure that is all being channeled up both at the mission level and then shared back here with us in Washington, so that we can make sure we're undertaking, wide-ranging and effective responses to the best of our abilities.
Great. Thank you. And as we noted, if people have more questions, and as Mark and Chris have mentioned, we have, we're actively trying to respond to all these questions that are coming in this evolving situation. And so please continue to share your questions. You can also share them via Catherine Brokenshire-Scott, the ASAP project director, and we'll make sure to send them along or send directly to some of the emails that were mentioned in Mark's earlier presentation. I think, Chris, you're back on, is that correct?
Yes.
Yes, okay, yeah. Great. We'll
you can hear me,
continue.
Great. Sure, sorry about that. So what I think I may have left off around the time that I was describing, the various concerns you might all be having about responding to COVID-19. And just to be clear, the communication about whether or not you're responding to COVID-19 would come through the USAID management team. But in addition to that, we also want to make sure that we've covered every aspect of questions that you might have. So as it relates to implementing the PEPFAR program, the key here, the key underlining fact is that the PEPFAR program is still the main priority. So we will love for you to adapt and be flexible and innovative in any methods that you see fit to be able to continue to maintain your HIV targets, to maintain people on ARVs. So as long as these activities and methods are still obviously within scope or within your program description, this is going to be exercising your best discretion to determine whether something is in scope. And if you have, any doubts or concerns, feel free to reach out to your AOR, and they know the scopes of work in and out. So they'll be able to tell you if procuring X commodity or something specific as far as a service is in scope or out of scope. But again, just to highlight the changing circumstances in the environment you're operating in, we understand the risks involved. So we would just ask that you exercise all innovative, flexible methods that you have to maintain and continue on the path of treating HIV/AIDS targets that are in your award. Over.
Great. I don't think I see any other particular questions right now for you all as I'm looking, and please, Catherine or others, let me know if I'm missing something. Any last opportunity with Mark and Chris to ask any questions about what they just shared or anything else? And noting, of course, if you share questions later after you've had a time to think about it later, you can always send them in and we'll respond in writing afterwards as well. I see one question. Let's see. Something on what types of strategies should we use to protect and not to stay more, I think trying to not to maybe to be exposed to the coronavirus. I think that's probably more of a technical question, but I think Chris addressed it a little bit in saying thinking of creative approaches. I know we talked a little bit yesterday about opportunities to modify the way you work to do video or phone types of communications, thinking about technology that could be used. And of course, depending on your country context, what might be still possible for gatherings. But I'm not sure if I'm getting at the question exactly. Any, Chris or Mark, anything to add on that? What kind of strategies should be used?
Debbie, you got it. I think that answers the question from our standpoint, is that just use whatever flexibilities and innovative methods you see fit for your context and in where you're operating.
Great, thanks. Okay. So thank you so much, Chris and Mark. And I know you all are really busy at this time, so we really appreciate your chance to talk with partners directly and us on this. And as we noted, we will follow up if we have any other questions and be in touch. And we will now transition back. Thank you again, Mark and Chris. We'll transition back to Aaron and question and answers that we had started for the expenditure reporting.
Sounds good. I'll be online for the remainder of the call, just FYI.
Great, thanks, Chris. Thanks, Mark. So Aaron, can we get you back? Are you?
I am here.
Great.
And scanning through the questions as well.
Okay, so I now seem to have lost the questions for the ER. The only thing I see up related to ER right now is, will IPs be required to report on specific activities for COVID-19 as part of PEPFAR ER? And then maybe I'll turn it over to Catherine Brokenshire Scott to read out the other questions, since I seem to have lost them.
Sure. To answer the question, I think the guidance still stands that what you spend with PEPFAR funds is what you report. And this is obviously a very changing and environment, and guidance is still coming out on a daily basis on all of this. But we will certainly have more guidance specifically on this as it becomes the time to report. But I think just keep in mind the guidance still stands that what you spend on PEPFAR dollars is what should be reported.
Okay, thank you. Erin, we have a question. Typically, how much is allocated in the budget for administrative and core costs?
Okay, I think we did touch on that, but I've also seen a couple of other questions on program management in general, so maybe I can just speak to that a little bit. Again, as far as what is allocated for admin and core costs, that is a budgeting process that is done by USAID. It is certainly in collaboration with knowing what your AOR COR knows as what your indirect costs are or what your NICRAs are, and so that is something that is done by USG. So it's known basically, and I think there was another question here on indirect. There's a lot of questions here on indirects. So essentially, again, you think about there's the direct costs, or the expenditures that are directly related to the project, and then there are your overhead and your indirect costs, whether that is an organization that has an ICRA or an organization that does not have an ICRA. You are still incurring indirect costs. You still have, an executive that runs your company. You still have some staff that worked on business development in order for you to win this proposal. You have finance and admin staff. We do want to include those, but they are indirect costs. And so you likely have some indirect cost structure in place. And so if you look at the guidance, and again, the link is at the end of the presentation, where you can go to datum.zendesk.com and you can read the guidance, and there will be more inclusion and exclusion criteria on this. Sort of more looking at broadly on high program management, or what the perception is of high. I could tell you that there is absolutely not a threshold that says what high program management is. It does depend on the partner. It does depend on the context. There are some countries that we work in that are conflict countries, and the program management is just simply going to be a lot higher because there needs to be security costs. You're flying instead of you're driving. You need extra security for the staff, things like that. There is not one percentage that we say if it goes over this threshold, it's a problem. However, I think that for the question on is 50% program management too high, what that's saying to me is that of a $2 million budget, 50% of that is going to the program and 50% is going to admin. I don't think that, I'm not aware of a project that actually has 50% program management costs. I don't think that's the story that we're telling, is that 50% of a budget is going to admin, or only 50% is going to the program. But I think it's certainly something that you should talk with your AOR and your COR. It is something that we look at, but it's, from my perspective, your NICRAs, it's negotiated and it's fixed. There's not much that we can do about that. And so there's not as much room for us to talk about reducing a program management budget. We can't really do that since that's really driven by indirect costs. But certainly it is something that we do look at as, considering the work that we're doing, we do want a large portion of the funds to actually go toward the program. But, from my perspective, it is absolutely understood that a certain amount of program management is required in order for us to deliver services at high quality.
Okay, we have a question. We report our socioeconomic program area activities around stigma and discrimination.
Right. So if you look at I think you broke up a little bit. The question is, or at least for me, how do you report socioeconomic activities around stigma and discrimination? Again, when you pull open the guidance, those activities would fall under the sub-program area of psychosocial support.
Okay, to make work easier for the IP, why isn't ER aligned to the quarterly USAID financial reporting?
We don't typically have partners ask to send us more reports, so that's a great question. I think that this is something that we are looking at our results data on a quarterly basis, and there absolutely is a desire for us to look at our expenditures on a quarterly basis as well. But we also have to consider a number of contractual changes that would have to happen in order for us to do that. Certainly having that information is very helpful though. But there's just a couple of things that would have to change in order for us to be able to require that. Not to mention, I think that partners are, you're implementing the project, and we want to try to minimize as much of the requirements as we can so that you're devoting your time to actually implementing the project. But I think that having additional data collection can certainly be useful as we're trying to understand the progress throughout the year. But at this time, I think it's something that OGAC has really wanted to do, but I think it's proven to be a challenge on a couple of different just administrative fronts.
Okay, and how does USAID verify the authenticity of the ER? Because it looks very different from a typical fund accountability statement that is audited and submitted to the OIG.
And that is a great question, and is why I was saying that my presentation and the expenditure data is very distinct from what Catherine was presenting on yesterday, and is the SF 425 and the reports that you're talking about that are subject to audit. Expenditure reporting is data, and it is not a financial audit. This is not the information that is subject to an audit. That is not the intention of expenditure data. It is data for decision making and for program planning. And that essentially means that it is your best estimate. Now, our expectation is that, if your accounting records show that that $2 million left your bank account within a given fiscal year, that top line amount is going to be $2 million. And if your cost categories say you spent this much on personnel and this much on, all the other cost categories, we are expecting that is going to be, quite accurate according to how you're submitting your other financial reports that are subject to audit. But we understand too that your accounting systems are not set up according to program areas, and they're not set up according to beneficiary groups. And so it is an estimate that we take into consideration. It is one of the data sources, and we looked at the many data sources that we have in PEPFAR, but it is one of the data sources that we look at for program planning and management. And so it is very distinct in that sense. It is the way that I try to look at things is that the ER report, it's data, whereas the other financial information, like with your SF 425, that is your actual spend. That is what that is what your reimbursements are based off of. That is what you're subject to audit. They're very distinct sets of information.
Okay. Should IPs align their fiscal years to that of the USG? If not, then why not?
Again, I don't think that I am going to be prescriptive to organizations as to how they should structure themselves internally, but you do see what the reporting period is for USAID and for the US government more broadly. So regardless of how you are structured as an organization internally, you will need to submit reports to us according to the US government fiscal year.
Okay. Can a local partner who does not have a NICOR charge a flat percentage as an indirect cost and does not have to itemize these costs as other direct costs?
So I'm not a contracts officer, so I'm going to be a little general on this, but I would say that from my perspective, all organizations have some form of indirect costs that they incur in order to implement a project or a mechanism. And so I'm going to defer that you ask that question more specifically to your AOR, your COR, your activity manager on how they expect you to report your indirect costs. But certainly we do expect those to be reported if you incur them, and that they are different from your direct costs.
Okay, and will IPs be required to report on COVID-19 as part of PEPFAR ER?
Right. So I think we got this question a little bit earlier too. So again, the qualifying factor here is if you are spending PEPFAR funds. And as this situation plays out and we are getting guidance daily as everything changes and how the work may change, what doesn't change is the qualifying factor of if you're spending PEPFAR funds, that's what needs to be reported. At the time that we start reporting in around September, which is when you will start to hear from USAID about expenditure reporting and the guidance and template is released and all of that. Certainly if we don't, I think more will be clear then, but we will touch on it at that point too. But at this point, as long as you're spending PEPFAR funds, it must be included.
Okay, and the last comment is quite nice. It's expenditure reporting is much simpler than EA. So thanks to team for that.
That's great feedback. Thank you. We're glad that it's a little bit easier on the implementing partners. I think we lost a little bit of the detail and the specificity of what we're spending our money on, but I think that the detail that we have is enough for program planning. So thank you for the feedback.
Okay, so that's all for our questions, and I see some people are starting to drop off. We will be sending out the presentation shortly after this session, and we'll be following up with the full questions and answers that will be sent to all participants probably next week. Debbie, do you want to say anything else before we sign off?
Just huge thank you to Erin. That was a really great presentation, a lot of information. So I'm sure as people digest it and really begin to work on expenditure reporting and think about the categories and planning for it, you may have more questions. So please feel free to send questions in. As we noted, I think yesterday and this morning at the beginning, or this afternoon at the beginning of the webinar, we plan to have a follow-up on budgeting and also on expenditure reporting as you get closer to the time where you need to report on it all. So stay tuned for that later in the year. But again, if you have questions, please send them in. We'll be following up with the presentations, with the recording of the webinar, and with the question and answers written out. I think that's all for now. And thank you also, of course, to Chris Nicola, if he's still on, and Mark Walther. And if you all have questions related to COVID-19 in terms of your award, always reach out to your AOs and COs in the field and your AORs and CORs, but feel free to also send us questions and we'll do our best to answer. Thank you all. And with that, Catherine, any last final words?
Yes, we'll be sending out the survey later on today or tomorrow for you to complete. We'd really appreciate your feedback in terms of how useful these are and what topics you would like us to address in the future. So watch out for your emails for that. And thank you for your participation. Over and out, everybody. Bye-bye.
Thank you.
Bye-bye.